Juliana Merighi, welcome to the show.
Thank you for having me.
Awesome. How's it going today? How's the weather in Colorado?
Oh my gosh, it's finally cold. It was like snowing for 2 seconds instead of raining. Just been such a weird winter.
Yeah. Is there like some snow in the mountains now?
Yeah, but I think, and this is kind of like all over the West right now, it's like because it's been warm and then the new snow like increases the risk for avalanches. So
Ooh, right.
yeah.
Are you like a
So
winter
it's
sport
there's some
person or do you just climb?
I snowboard. Um I actually didn't get this is my first time not getting a pass, which is like pretty awesome. Year to pick not getting a pass. But I wouldn't say I'm a snowboarder. Like I've never done a black. I don't know if I have an interest. I took like a class once on the like baby terrain park, which made me feel really cool. But yeah, I'm mostly a climber.
Okay. Yeah, that was my next question was like, if you don't identify as a snowboarder, like, do you identify as a climber, you know? But it sounds like you do.
Yeah. Yeah.
Yeah.
Yeah. And I feel cool about that because, when you look at like all the research papers about climbing, it's like ever since the 2020 Olympics, it's like got really popular. And I started climbing like the fall before those Olympics. I was like, I got in before it got popular. I'm cool.
The fall before, so wait, fall 2019? Because the
Yeah.
Olympics were, okay.
Wait, when were they? 2021?
They were actually in 2021, yeah. So,
Yeah. Okay, it was the fall before. It was the fall before.
gotcha. Yeah, I
Yeah.
have like a memory of going, like some winter traveling in the winter of 19 to 20. And now I reflect on that and I'm like, whoa, that was like the calm before the storm, before things got, yeah, totally crazy or totally
Yeah.
crazier, I suppose. But yeah,
Sure.
nice. Where did you start climbing? Were you already in Colorado?
Um, I was on a clinical, so I went to the University of Miami for physical therapy school, and I was like, you go on clinical rotations, and I was like, well, I'm always going to live near the beach, so I might as well like go to the mountains for a rotation. So I went to Colorado, and I was like, I'm going to do all the Colorado things, and climbing like wasn't even on my radar. Like I was like, I'm going to hike. I'm going to like step into mountains. It was my first time ever seeing mountains. So like the last 2 weeks of that rotation, I was on a trail run and I saw someone climbing on like rocks and I was like, what the heck is that? And I coincidentally had a patient who climbed and I was like talking about how I saw this and they were like, hey, do you want to go climbing with me this weekend? So they took me climbing at Shelf Road in Colorado. I don't know if you're familiar.
Hmm.
So that was like my first time ever climbing, very unintentionally. I was just like trying to do all the things, but thank God I did that in the last 2 weeks of my clinical rotation though, because I just like didn't care at all for the last 2 weeks. I was like, I want to climb every day.
Nice. And then
Yeah.
you just were like, I don't need to go back to the beach. I'm a mountain person now.
Yeah. I came back because I moved back to Miami after that. Like I had to finish school. And I would drive like I don't know if you've ever been. I mean, like the East Coast traffic is just like different than like around here. But I would drive in like 45 minutes of traffic in Miami to go to the closest climbing gym with like three other people there.
Yeah.
Um, and I spent a few more months there, and then after I graduated PT school, I was like, all right, then I moved here.
Back to Colorado. Cool. Yeah.
Yeah.
It sort of just like, it's funny how that happens. And as a coach, I talk to so many people where this is true that like they started climbing and their life just takes like a hard right turn or whatever into everything is about climbing. It's like, how can I be closer to climbing and spend more time climbing? And people of all ages, people of all like demographic backgrounds. It's so cool how it like takes hold of people like that. It's neat.
Yeah. I'm sure, like, I like to think that that happens in other sports, and I'm just not like familiar with it, but it
Yeah.
but also, at the same time, I'm like, it feels like one of those sports that is unique in that way, where it's just like all encompassing. Like, I used to row, and I like definitely was like, I need to row forever, you know, and I'm like, I need to kind of climb forever. How can I
Hmm.
keep doing that? Like where I never like picked travel so that I could find a boat and row in it. But here I'm like, okay, where I travel, where's the closest climbing?
Yeah. Yeah,
So it's cool.
100%. I think it's like the difference probably is like with other sports. I don't know if rowing qualifies, but it just feels like the window for a sport to become your whole personality is really short for most sports, you know? Like if you're going to be like all about basketball or football or something, you probably play it when you're a kid and then your participation is like largely you're spectating or like doing some pickup games or something later on in life. But with climbing, like I meet people who start climbing when they're 41 and it becomes like their whole life.
Yeah, hi baby.
Yeah. That's Charlotte saying hi. She wants to be on the podcast.
I get it. Start her young so she doesn't have performance anxiety. Um, yeah. Yeah, it's so cool. It's so cool. This is like such a random little side story, but there's this guy in, I don't know, probably his 60s who found climbing and like got all the gear and is having coaching and he wants to like surround himself with like only climbers and he's in his 60s and once he held a dinner at his house and it was like a bunch of us in our like 20s and 30s and then he's like I really want to like have a conversation about climbing and like what pro climber can I also invite to this dinner and like Lynn Hill ended up being there just so
Wow.
random. He's like, and it's funny because I'm just like not good. I'm not good with names. Like I'm not good with names of movies, of actors, like all the things. So I actually didn't even know it was her the whole
Okay.
dinner until after. And we're just all chatting, and I'm just like, oh, we're just a bunch of climbers coming together. But it's just so funny because it's this guy who's just like, you know, older, and now just like I want to just be in this world.
Yeah, for sure. It's my bias, like my bias in people. Like some people, I feel like are biased towards like they want to hang out around more like men, or they want to hang out around more women. Especially like women like to be around men, like to be around men or whatever. And I'm just like I just want to be
Sure.
around climbers. Like I feel like climbers are just cool people.
Yeah.
I don't know if that's
Yeah.
just because I'm socially awkward and they're easier to talk to about climbing. Could be,
I feel that. I feel
but
that.
it's so rad that it's like such a yeah that there's people in their teens and in their 60s who are and honestly probably single digit kids too who are like it's their whole life to climb. Yeah, we're lucky
Yeah.
that it's such a cool
Yeah.
thing.
Yeah. I think so
All
too.
right, okay, walk us through your before we just yeah glad hand climbing nonstop. You mentioned that you went to PT school, so walk us through like your education and your area of expertise.
Yeah. Yeah, it's funny because it all, you know, we just talked about like climbing kind of becoming your personality and it all just kind of molds together. But my education, I have my bachelor's in exercise science. I went to Sacred Heart University in Connecticut. Then I went down south, got my doctorate of physical therapy at University of Miami. After school, I ended up getting my CSCS, so clinical, or what does that even stand for?
Certified
Strength and
strength and
condition,
conditioning specialist.
certified strength and conditioning specialist. Um, and then also I have my OCS, so that's your orthopedic clinical. That's where that specialist comes in. Um, and essentially, it's just like you know extra training in this area. But when I first started climbing, that those last 2 weeks of my clinical rotation, it's like we would go climbing, then we would go back to their houses and be like a bunch of us sitting in a room, and they're lining up. There was like five of us. They're like, this hurts, this hurts, this hurts, and I'm like, well, I'm learning, so let me practice all these skills on y'all and like just see what happens. Then when I went back to Miami and joined that climbing gym, you know, there was like 3 to 5 people. It was at Coral Cliffs, which unfortunately I don't think they're a gym anymore, but um, there was like 3 to 5 people who would be there when I was, and so we all knew each other, and they knew like I'm in PT school, so same thing. They're like, hey, they just had so many questions about their bodies. They were super curious, and I was like, oh, this is very cool to be around people who are like very curious about their bodies, like hadn't experienced that in like other realms of physical therapy training that I was found
Mm-hmm.
myself. So then I was just like, all right, well, I like climbing. I like the people who climb. I'm gonna work with climbers. Like that was very clear in my mind.
Cool.
And so I'm very type A. And so then when I like remember we had a meeting with one of our professors and I was like, tell me every single thing that I need to do to be like a good candidate to get a job. Cause I was like, I need to get a job in Colorado and I don't have any resources there. And so one of the things was like, things that would help you stand out is pelvic floor PT. And I had like taken some elective classes in PT school and just had my own experience with some like pelvic floor topics. So I was like, oh, well, that's got to be like the first continuing education class I take so that I can go into these interviews and be like, hey, I want to be a pelvic floor PT, hire me. And it actually worked out. Yeah, and it worked out pretty well. So then I start seeing, like, I'm seeing pelvic floor clients, I'm seeing climbers, and I'm like kind of going like this, and I'm like, oh, this is really cool. Like, I'm really enjoying treating both of these populations. And it was just like kept going like this. And then sometimes would come back together because then all of a sudden it's like a pregnant climber or someone who just happens to have some pelvic floor symptoms and they climb. And so I'm like, oh, how can I like really blend these together? And that's where I find myself in the space now where I work with climbers, I work with pregnant postpartum, and I also work with, pregnant postpartum climbers.
Right. Yeah.
So it was like this cool blend.
Yeah. You have like your specialty kind of areas, and then also those areas you can work with those populations like at the same time. Did you ever have a phase, I guess in rotations maybe, but did you have a phase where you were just working with Gen Pop people on their, 72-year-old has a, problem with their hip or something like that, like sort of basic PT stuff?
Yeah, totally. I mean, in my education, like I had rotations with like, it was like a general orthopedic, so like Gen Pop. I had a rotation in like a nursing home during COVID, which was like crazy.
Oh, wow.
I had a rotation with kids. Like I feel like I've seen it all. And then even my first job, like at least my experience wasn't like, okay, now I'm a physical therapist, I'm just going to see climbers. Like it took time to do that. So yeah, kind of Gen Pop. And I love that too. Like, it feels really helpful in the pelvic floor space for me because I have that like orthopedic training. And when you become pregnant, you don't lose your arm. Like you don't lose your leg. You can still hurt your arm. Not because you're pregnant, but like other things can still happen, whether you're pregnant, postpartum. So it's like good to have that training where it's like, oh, we're working on some pelvic floor stuff and now you have a finger injury and we can start to address that as well.
Totally. Yeah, it pays to have the general. I mean, I'm obviously not a PT, but anybody who's a climbing coach is going to work with people who get injured and like want some help navigating that. It's just like inevitable to the point that I've like mentored other coaches and I've been like, get ready for people to ask you about their finger injuries because it's, no matter how many times you're like, I'm not a doctor, they're going to want to like ask you about it. And I'll be like, how bad is it? And if it's yellow light, like maybe we'll work on it. And if it's red light, it's like, yeah, you need to go talk to somebody who knows what they're doing. But like, it just pays to have some general understanding of those things. Cause yeah, everybody hurts their fingers probably, including pregnant women, I have to assume.
Yeah, no, totally. So yeah, it's good. And you're so right. Like once I gave a talk to, so I also teach yoga. And once I gave a talk to this, like, to become a yoga teacher, you have to go through this training. So I was a guest speaker at a training where I talked about like, what do you do when someone who's pregnant walks into the door? Because they're going to ask you, like, they're going to expect that you have, just as a yoga teacher, like, they're going to expect you to know how to like hold space for them. So yeah. Same thing with coaches.
And that's yoga teachers are a really interesting one because there are like certifications and processes, but it's not like being a PT in the sense that like the education is like much less rigorous, and when you go to a yoga class, you really have no idea if that person's like spent 10 years in Bali doing yoga training or like has only been doing yoga for like a month longer than you. Like there's no real like, so it's interesting. But I don't know. I guess I've had good experiences with them helping like modify things and stuff. So maybe it's pretty
totally,
good.
Totally. And it's like, to be honest, it's, people, and I teach prenatal yoga now, and other yoga teachers will be like, what should I do when someone comes in who's pregnant? I was like, well, like probably what you would do if they weren't pregnant. Like there's really not a lot of modifications that you need to do. Probably don't want to have them laying on their stomach the whole time. And
Yeah.
also you probably won't have to tell them that. Like
Yeah.
they probably
Yeah. Yeah.
just won't.
Should be like pretty obvious. Yeah, that was like a
Yeah.
question that I had, was just thinking about other PTs that I've worked with through the years of being a coach, and also people I've had on the podcast. And I see there being a really big difference between the way that a PT would work with like your average person who's just trying to hang on to mobility, or your average, whatever, 40 something person, not an athlete, who just, hurt their shoulder picking their kid up or whatever, like very basic sort of general population. There's that population. And then there's like the climbing population, where the injuries are like often a lot more intense, often like, more traumatic, often just purely recreational, in the sense that like it's not damaging their everyday life. It's just something that they
Sure.
want, And like, do you treat those populations differently in your mind, or is that all kind of the same challenge to you?
Yeah, it's such a good question. I'm not sure. Like, like, in my mind, everyone's an athlete, even if, like, they don't view themselves as an athlete. Um, so I don't really treat them that much differently. Like, if someone comes into me with elbow pain, or if someone comes into me and they're pregnant, and both of these people are like trying to navigate like how to keep climbing, like just because it's two different diagnoses or two different things that's going on, but we're still talking about like um what terrain might feel better for you, what is your history, what are you currently doing, like what are you doing when you're on the wall, how are you outlining your sessions, how are
Mm-hmm.
you outlining strength training off the wall, are you strength training off the wall. So it's like these conversations I'm having with everyone.
Yeah.
Yeah, that's what I'm trying to say.
Yeah, you introduced the pregnant person population, which is like the next thing I was going to ask about, because I think something that has, yeah, like I said, having PTs on the show and stuff, and just meeting PTs over the years, talking to Tyler a bunch, and other people like that who've had an influence on me. It's like, I'll use the example of my mom, who she's a little older, and she listens to this sometimes. So if you're listening, hi mom.
Ah, hey.
But she was like, at some point she was like, what exercise should I be doing? Like, tell me like how to exercise. And I remember just being like, well, you should hinge and squat and push and pull, because that's like what like there's no special population that like shouldn't do those things. And I don't know if I would have thought about it that way like 15 years ago or something. And I feel like it's becoming more well known that it's just a human thing, like the way we exercise. It's not like a special thing for, and I guess that mirrors kind of what you were saying, that like everybody is sort of an athlete. It's just we all have different starting points and different like loads we can tolerate and stuff. And then I was going to say, is it the same for a pregnant person? So like, what is really
You're
different
teeing
about
me
being?
up.
Yeah, totally. I'm doing my best. I'm an amateur podcaster, but I've learned a thing or two. So what is different about being pregnant from being a normal person?
Yeah,
Not that pregnant people aren't normal people.
they're so weird. Um, you know, I have to say that the biggest difference is just in the messaging that they receive. And the message that they receive is traditionally like, you probably shouldn't squat, you probably shouldn't deadlift. Definitely don't push something overhead. Like, you should probably just like keep walking, you know? And so that is not the message anymore. And we have like fantastic research to support that. Like, exercise is actually, to squat, to deadlift, those things are really important to do. Well, not those specific things, they can be, but
Yeah.
exercise in general is just really important to do throughout your pregnancy, leading up to your pregnancy, like for your whole life.
Hmm.
But they're told not to. So I think it's just giving them confidence and autonomy to make decisions for themselves on how they want to move their bodies. If someone hates squatting, hates deadlifting, then like, okay, what do you like doing? And
Hmm.
let's lean into that. Let's say someone like is like, well, I hate exercising. I don't like moving. All right, why? And my job is to promote exercise. Like if you come in and say you hate exercise, I want to dive into why and then find something that you will enjoy because I promote that.
Yeah.
So, yeah.
That's cool. So do you view your role working with pregnant people more as like trying to encourage them and push them, and there's really not a lot of like restriction or like pulling them back from doing things unless they have like symptoms or something, I assume.
Sure. Complications come up throughout pregnancy, and for the most part, those complications aren't restrictions to
Mm-hmm.
exercise. You can use exercise to address the complications. So let's say there's like gestational hypertension, so high blood pressure when you become pregnant. This is something that happens to a lot of people. And
Mm-hmm.
so you can use exercise to address that complication.
Yeah.
Getting shortness of breath is going to happen, right? You can use exercise to make you feel more physically prepared. Now, like if we want to talk about what's a reason for you to absolutely 100% not exercise, there are very, very, very rare scenarios where you're not just out of breath. I'm sitting here right now and I can't even breathe. That
Mm-hmm.
sounds like an emergency though, right? Like we wouldn't
Mm-hmm.
be thinking about exercising at that
Whether
point.
you can
So
run or not at that point, yeah, it's like out the window. Yeah.
yeah. So just because you get short of breath, that doesn't mean like, oh man, I just can't exercise. It's like, all right, let's find ways where you can exercise. Maybe you have to change the activity. Maybe you have to change the intensity. Maybe you have to change the duration. And
Mm-hmm.
then that can make you feel better moving your body. And oftentimes it does.
Yeah. And I think later, so I mean, we have a 4-month old, so obviously I just witnessed some of this, and there's a certain amount of exercise that like the natural intensity is just so much higher because of what's going on in the body and the body weight change. Like, climbing when you're plus 50, 60, 70 pounds is like obviously going to be quite a lot more intense. And so like even a shorter duration can still be like pretty intense exercise. And I might get the numbers wrong, but on the hypertension thing, I want to say that pregnant women have like 30 to 40% more blood in their bloodstream. So their
Ooh,
heart is like, I might get the number wrong. I apologize if that's wrong, but I remember early in pregnancy, I talked about it with my wife, and it like kind of blew me away, like because their heart and the cardiovascular system in general, like just has to work a lot harder to cycle more blood through the system to be like prepared for this thing that's using up a bunch of their blood while they're
yeah.
growing a baby.
Yeah. I'm not sure on those numbers, but I mean, it makes sense to me. And I mean, when you think about too, like the placenta, which is like kind of feeding the baby, the
Mm-hmm.
placenta uh, is something that you're also it's like an organ. It is an
Mm-hmm.
organ, and you grow it. So it's
Mm-hmm.
like, blood's going. There's so many things that you're not just growing a baby, but you're also growing an organ. Your like body's just working harder. Um, yeah, so it's fascinating.
It's completely mind blowing, and any parent probably who can listen to this can relate to what I'm saying. That like, I think every day when I hold my baby, I'm just like, it just blows me away that she was like grown inside of another human, and then I'm like, wait, I was grown inside of another human, and I don't want to sound like I'm, some kid who's like smoked pot for the first time and is like thinking this stuff through, but like it is pretty bizarre when you really think about it. That there's a machine in there that's doing all that stuff. So, yeah,
Yeah.
that's besides the point. Okay, so pregnant populations really not so different. I mean, we talked about there are some severe complications, but like what are the things that do affect the way that pregnant people exercise? So like I know there's relaxin and like there's obviously physical changes. Like can you talk about some of that stuff?
Yeah, totally. And I think like, maybe now's an important time to say too, like, here's a disclaimer.
Mm-hmm.
This is like not medical advice. And what I say, maybe someone's not going to resonate this because at the end of the day, like your pregnancy and your postpartum journey are so individualized. So I'll just try to like
Yeah.
make broad statements with that. But yeah, and I say that because there are some people who they don't have to change a thing when they're pregnant.
Mm-hmm.
That's pretty cool that they don't have to. And then there's some people who because of maybe some complications, they do have to change how they're exercising. And relaxin gets a lot of like, oh my God, relaxin, my joints are so hypermobile, and I don't want to work out too hard and risk an injury. It's something that I often hear. And they've looked like relaxin is a good thing. Like relaxin does make you more mobile, especially your pelvis, which we want the pelvis to be a little bit more mobile to may have space for like and room for the baby to come out. But it's not to a degree where it's like, oh, if I, lift heavy weight, like I'm probably going to tear a muscle or tear a tendon or something like that. It's not to that degree. So I think like that hormone gets thrown around a lot, and it's like there's so much more that goes into play than just like the relaxin. There's so many different hormonal changes that are happening, throughout your or when you become pregnant and then after you deliver. But with that, some people are more susceptible to getting like pain in the front of their pelvis or pain in their low back, especially with like, you are all of a sudden carrying more weight. So like you want your body to be prepared for that. And if it's not, you might have some pain, some discomfort. And so like some examples would be like if your leg is out to the side, like let's think of an exercise where your leg's off to the side. Like if you're doing a side lunge, that could be a little bit more uncomfortable because there's like it's pulling on your pelvis. And so maybe you don't do a side lunge and you just do like a squat, right? Or what are some other things that sometimes people like they're doing a deadlift and all of a sudden, their belly's in the way of that deadlift. It's not stop doing the deadlift. It's maybe do a sumo deadlift. And like you bring your legs just a little bit more out to the side. So it's typically not like, oh, this exercise is bad for me. It's, okay, how can we change how you're doing this exercise? Maybe we have to change like the depth that people will go down. Or when we think of climbing, it's like there are some people who they love overhang climbing. And so they feel pretty comfortable climbing overhung throughout their pregnancy because that's what they're used to. That's what like they're stoked on. They have fun doing that. There's some people who's like, that overhang climbing is going to start to get a little bit more hard because they feel like they can't keep tension as they used to, or they can't get a heel hook as they would like to. So they have to start changing. Maybe they do more vertical walls, or maybe they do like that overhung, but it's like a little bit less intense of a climb. So it's like this trial and error, which we do with any injury. Right?
And I do that with all clients who aren't even injured. Yeah. This is like, what equipment do you have? And like, does this thing, bother whatever? Or is this range of motion appropriate for you? Or there's always like modification of exercise. It doesn't really sound like this is actually any different. Yeah. And I think that's like great news. And I think, which I'm sure you do as well, it's like, here's all the information. Here's how you could approach different scenarios. And you get to decide what you want to do with that information, which is really powerful. Yeah, they can do anything. They can do whatever they want, basically.
They can do whatever they want.
It's reassuring. That's reassuring.
I think like maybe with the exception of like, I don't know if you should scuba dive. Like that might actually be an absolute contraindication.
Yeah,
like,
and I mean, I feel like there were some guidelines. Like my wife and I, we boulder. Mostly. I liked sport climbing. But she hasn't been as into it for the last few years. And while she was pregnant, we did a lot more sport climbing because it was just easier for her. And there's a period, I guess, I think it's in the first trimester, you're like really not supposed to fall. So we like didn't really boulder, or she didn't really boulder like as much in the first trimester. And then like she did a little bit in the second trimester. I think it's like pretty normal to feel really good in the second trimester, it seems like. It's like the hormones are hitting, but the baby's not huge yet. And then in the third trimester, she just felt like too constrained to be able to like boulder at that point. But sport climbing seemed great for a lot of it. And I don't know, in some sense, I think it was like good for her technique to have this weight vest. Like she's very like front wheel drive. She likes to pull with her arms. And so I think it was like good for her to have this weight vest on and like have to use her legs a lot more. Like I watch her climb now and I'm like, ooh, I think your technique is like actually like a lot better after being pregnant.
That's amazing. Wait, and that is what people say. They're like, when I was pregnant, I was actually able to get better because of technique. Like maybe they weren't pushing grades, maybe they weren't pushing intensity. Although if they decided that that's what they wanted to do, fair, do it.
Yeah.
But
Yeah.
a lot of people just intuitively will say, you know, like I'm going to save that, and right now I'm going to focus on technique or building endurance. So it's cool.
Yeah.
But wait, I want to rewind.
Oh, go ahead. Sorry. Yeah, rewind. Yeah.
Yeah, I was just gonna say I want to rewind to wait, you said that she should not fall in the first trimester. I'm just curious, like why?
I honestly, I don't know. I mean, it goes back to some other history that we have, but I think somewhere
Oh, fair.
it was like if there's danger of losing the pregnancy, then you're like not supposed to fall. Like bouldering at the end of the day does involve a lot of falling, you know. So if you could boulder and know that you weren't going to fall, maybe that would be safer. But I don't know. You're the expert. You tell me. I just know some shit that I heard because I'm a man and I was standing there at the time.
Yeah. No, listen. I think there's I'll support you being a man and like just standing there and hearing it and then repeating it. But I don't think this is a man problem.
Sure.
I think like this is just, this is not just men are saying this. But yeah, you can totally fall in the first trimester. Now the first trimester, it's this like, oh my God, I just got pregnant. I don't want to lose this baby. And we're all on the same team there, like every medical provider, right? And so I think because of that, there is and because like miscarriages, unfortunately, they're pretty normal and they happen more times than I think we talk about. And so no one wants to like take the blame for that. And so everyone's just kind of like, we're not going to do all of these things. Like for a pelvic floor PT, you are not supposed to do any internal exam. This is funny because you're not supposed to do any internal exam in the first trimester for no reason other than like abundance of a precaution, but you can have penetrative sex. So I was like,
right.
That's interesting. But anyway, so, So I recently went to I went to my dentist and they did x-rays of my teeth. And before they did that, they were like, are you pregnant? I was like, no. Are you like, sure, there's no way that you could be pregnant? And I'm like, I'm definitely not pregnant. And also, why are you asking? Like, I'm just curious. And they're like, well, we're about to do x-ray and the radiation, but like, there's not really evidence to support that, but we just want to be careful. And I'm like, okay, cool. That's like what I was thinking. I was like, that's cool. You're just like being precautious for no reason other than just to have caution. So, I have to, and maybe we'll put this in the show notes. I feel so cool that I'm about to say this. Maybe we'll put this in the show notes. But there was a study that just came out about vigorous intensity exercise in your first trimester, and it's fine. It's fine. And I would say that vigorous, right? That vigorous is running, sprinting, jumping, doing CrossFit. These are things that lots of impact.
Intense, yeah.
So then let's take this to climbing. You fall on a mat, it's probably fine.
Okay.
So there's like, the falling in your first trimester, we just have no data or evidence to support that would cause a miscarriage. And it's hard to say like it will not because we don't have data, but it kind of aligns with everything else we're seeing where it's like, this isn't what's causing it, but yeah.
Well, it's something I noticed because I just like having the science that we have for things that are well studied. So, when I'm working with a client and some question comes up of timing of exercises or the way that muscles coordinate or like even like skill learning stuff, like I like to go on PubMed and read the studies about those things. It's just, I'm not claiming to be like the science-based coach or anything like that because I'm definitely not perfectly. But I just find that stuff really helpful because it's like, there's just a sea of shit that we aren't sure about. And it's good to know there is some stuff that we are sure about. And like, I found it actually surprising for pregnancy being something that, many people in the world go through. Like a very high percentage of people are either going to be a mother or a father at some point. And there's just kind of like a lack generally of science, especially on pregnant women and babies, because like it's so hard to study those populations ethically. That's my
Mm,
assumption. I don't actually that I mean I think that's a logical conclusion, but I don't know for sure if that's the reason. But there's stuff like is it safe to fall um, in your first trimester? Like they can't easily do like a randomized controlled
yeah.
trial of having pregnant women fall.
Fall every time you climb. Yeah, yeah, and a lot of like, so they have some studies now, and they're in development too of studies that are coming out. Margie Davenport, she's out of Canada, and she's just like the amount of research that her and her team are putting out is like, thank you.
Hmm.
I'm sure she'll watch this. So, but she's come out with some climbing studies,
Hmm.
and a lot of them is like, hey, when you were pregnant, asking all these questions. So it's not
Hmm.
like they're actually like
Survey.
running
It's like a
tests on them.
survey. Yeah. Yeah, yeah.
Yeah, yeah.
Which is
But
is
those
good.
do exist, just not with climbing.
Yeah, and it's better to have that science than not. Like even so, Hazel Finley you probably know who she is. She's a really well known climbing mental coach, and like she had a kid a couple
Yeah.
years ago, and recently did like a survey where she was just asking parents to fill out this survey, and it was talking about like do you experience more fear now than you did before, and like do you push yourself performance wise more than you did before, and do you feel like your kid holds back your climbing, and like all these things. And it was like, and it was for mothers and fathers, and so you just based on the number of people who answered it, you get a little bit of like a what if this has to do with parenthood, what if this has to do with like carrying a baby, or what has to do with like having the baby, because obviously we're going to get into birth and that's like its whole separate thing. But it was just really interesting to me to see this and be like, this is objectively not high quality science, because it's just a survey of random people on the internet and you have no way of knowing like what's true or anything. But it was still like, to
Yeah.
me as a new dad, I was eating it up because I was like, this is so specific to what I'm going through as a dad and a climber, and there's just not that much of that out there. There's just not very much to go off of. So, and this is why I wanted to have you on the show, because I wanted to talk to somebody who's an
Yeah.
expert.
Yeah, no, I think you're so right. And I think it's so cool because if you look at a lot of behaviors of people who are pregnant, or a lot of behaviors of doctors giving advice to people who are pregnant, it's based off of like, well, if like you ask a couple more questions, like, all right, why are you giving this advice and why are you saying this?
Mm-hmm.
It's like, well, I actually don't know.
Yeah.
And we actually don't have evidence on this. But I think that like I think what I've heard, I definitely don't do this because I ask my doctor so many questions. They're like, probably like, get out of here. But like, I think we just like, oh, the doctor said this, and we don't ask those follow-up questions, which makes sense. To
Mm-hmm.
some degree, that makes sense. Like, we just want to trust and believe that we're getting informed
Yeah.
and evidence-based advice. But then we start to behave, right? So if we do have these studies are great because they're a starting point, and it's like, okay, well, what did you do in your first trimester? Well, I took things really easy and didn't exercise. It's like, okay, so we have a bunch of people who maybe did that because of things that they were told. Well, now we have evidence to say like, oh, you can like vigorously exercise and you're fine. And they also did, they also looked at not vigorous, but just like exercise throughout the first trimester. And these people had like better pregnancies and they had less complications. And it's
Yeah.
like, oh, cool. So like these behaviors are protected, right?
Yeah. That was
It's
one
cool.
piece of science that I do remember encountering like pretty early in my wife's pregnancy, or maybe even before that. That was like basically what the authors were getting at was like, yes, there's probably some risk to remaining just like normally physically active, just because there's always risk to being physically active. But we have the same thing with like with general population. The analogy would be like, yes, there is a risk to running 5 times a week or whatever, right? You could fall and like hurt your ankle. But there's also a risk to like not doing that exercise, which is like an existential risk later on of like having cardiovascular problems or heart disease or whatever. And it's the same, I guess, in pregnant populations, but they were saying it through the lens of like, is it like good for you to like squat and deadlift through your whole pregnancy? Like, we don't know, and probably it does carry some risks, but for sure it's going to make birth easier if you're stronger, because it's
Yeah.
super challenging physically experience, like insanely challenging.
Yeah. Yeah. And I mean, like, maybe that I do say with confidence that, like, those risks have nothing to do. The risks don't increase because you're pregnant.
Yeah.
In fact, the benefits increase because you're pregnant.
Yeah.
Because it's benefiting not just you but also your baby. So like it's benefit times two, can we say?
Like your baby
But
gets
the
stronger when
risk,
you strength train, or I need to understand. I need to know.
yeah. No, like when you are more physically active throughout your pregnancy, your baby's birth weight increases,
Wow,
which is awesome.
that is
Um,
awesome.
yeah, and I didn't read the paper, so take this with a grain of salt, but I believe I saw recently that they looked at like cognition as
Hmm,
well and like saw some positive things. I'm not gonna like make any claims because I'm just not
cool.
familiar, but yeah, yeah.
That's crazy. Yeah, my baby, like I see all these reels, and this is neither here nor there. But as a dad, you get the algorithm feeds you dad stuff, and so like
Sure.
I see so many reels of people like holding their baby up, and they're like, this is the position that makes it really easy for your baby to poop, and the thing is just like folded into a little ball, and our baby cannot do that. She's so stiff. Like it's crazy how like her legs don't want to extend or anything. She's only relaxed when she's sleeping. And there's a part of me that's like, is this because Kim was like working out so hard through her whole pregnancy that our baby is just
Right?
like buff?
And I think we're conditioned to be like, oh, is it because she was working out?
Yeah. Yeah, we're
You
pattern
know?
recognition machines. We can't help it.
Totally,
I mean,
totally, totally.
when you're a normal person, when you're not a pregnant person and not a parent yet or anything, when you work out, you do there's like an endocrine response, like you do get more growth hormone, and like if you're a man, you get more testosterone, and for women in some cases too. And so like it stands to reason to me that like if she works out and she gets a little bit of growth hormone, that growth hormone's in her bloodstream and it's like going into the baby. So I can like totally rationalize it, even though I
Yeah,
have no
maybe.
basis for that whatsoever.
Kim, you should have sat on the couch so that your baby could poop.
Oh, I'm not blaming her. It's not her fault. No, no babies are just not good at pooping. That's a
Ugh.
fact.
And
That is a fact.
she's Charlotte, right? Charlotte?
Yeah.
4 months. Yeah, that's tough.
Yeah. It's just part of life. It's part of life. It's
Yeah.
hard. She'll get over it. She'll
Yeah.
get through it.
Yeah. We all
All right.
will.
Um, I realized that I probably should have started with the pelvic floor stuff and then gone to pregnancy, but I do
Ah,
want to talk about general pelvic floor PT and just, I mean, I think people probably have a rough idea of what that is, but can you just sort of explain what the pelvic floor is? What is a pelvic floor PT?
yeah. Yeah, let's do it. Well, let's start with what is the pelvic floor. Pelvic floor is like in your pelvis. It's a group of muscles that help do different things like handle pressure increase, which when I say pressure increases when you stand up from a chair, when you squat, when you run, like anything you do other than sitting, pressure is going to increase. Pelvic floor helps you keep in pee and poop, and then it also helps release the pee and poop. And your pelvic floor also functions sexually, so sex. And yeah, so when we think about like, it's hard sometimes to say like, all right, think about your pelvic floor because you can't see it. Like my bicep is here. I'm gonna flex my arm, and like I understand my bicep is doing that. You can't do that with your pelvic floor, so you're not seeing it. So
It's
it can be
intrinsic.
not super, yeah, it's just not super intuitive. So let's right now, you and I and whoever's listening, like let's find our pelvic floor right now and just like connect with it. So the way we're gonna do that is think about an A-frame house where the top is an attic, the bottom is the basement, and then in the center we've got the kitchen.
Okay.
Cool?
Visualizing.
Cool.
Yeah.
So in that A-frame house, we're gonna now compare that to our pelvic floor. So when we contract, do a Kegel with the pelvic floor, we're gonna move up into the attic. So we can do that like squeeze your butthole, squeeze your booty. Yeah, that's going up into the attic. And then when you go down into the basement, think about just like lightly letting a fart out. So we're like kind of just pushing down.
Okay.
And did you feel yourself do that?
I'm like trying to tell the difference right now. Never thought that I'd be doing
Yeah.
this when I started a podcast, but yes,
I know, sorry.
I think I understand the difference in principle. Yeah. I might need to practice a
Yeah.
little bit to be able to.
Yeah. And I think like, so as a pelvic floor PT, people are seeing me all the time for various like pelvic floor issues, whether they be male or female.
Hmm.
And that's like one of the first things I ask them is like, hey, what do you know about your pelvic floor?
Hmm.
And also, can you just like sit here and connect? And some people are like, oh yeah, I can feel what's happening. And like you see their eyes moving and you're like, all right, they're
Hmm.
going through the A-frame house. Some people
Hmm.
are like, hey, I have like I hear what you're saying, but I just don't feel any movement. That's where like, maybe we dive into that a little bit. But yeah, so like I think of it as like that cue of just like squeezing, pulling up. You can like engage your core, so it's like pulling
Hmm.
in, and then like pushing out, like you were to like you shouldn't do this, but like pushing poop out on the toilet, and that's going into the basement.
Don't
And
do this right. Don't do this right. If you're listening on the bus.
don't do
Yeah.
that.
Okay. Yeah.
Yeah, yeah. And if you're sitting on the toilet listening to this, like don't be like to get out for other reasons. But
Sure.
yeah, and so let's say like you're bouldering, you're climbing, and you fall and you land and you pee a little. Like in my head, that's a pelvic floor core issue that we can address. So, like, why would that happen? When you land, there's an increase in pressure. When we talked about how the pelvic floor should respond to that increase in pressure. And it's like too much pressure from the land. So now maybe some pee
Hmm.
is coming out. The gate is open.
Hmm.
So you can start like connecting with your pelvic floor. Not that that's what you're not traveling through the A-frame house when you fall. It's more reflexive, but it's just nice to have that reference of like what is the pelvic floor? How do these muscles feel? Kind of training your brain like, all right, this is what's happening here, so that when you land, your pelvic floor can automatically respond to that impact, that load, and not let any pee out.
Right. Okay. So you could basically, even though it's intrinsic, you can train it the same way you would train to absorb force anywhere else in the body. It's just a set of muscles. Is that right?
It's just a set of muscles. It's a little different because it's a reflexive action. Like when
Hmm.
I do a bicep curl, like I'm not just going like that. Like
Yeah.
I'm
Yeah.
controlling this.
Yeah.
And the pelvic floors, it's more it is reflexive, so you shouldn't have to think about it. But you can train yourself consciously,
Hmm.
and then with the goal of and knowing that hey, we're going to transition into this just being a more reflexive thing.
Okay. Yeah. I mean, so this is I'm possibly oversharing for the podcast. I'll think about this, but I've had like digestive problems for quite a long time, and the
Yeah.
muscles that help food move through your digestive tract are also intrinsic muscles. But they are muscles, and they can be trained and strengthened. It's just that you can't like obviously flex them um, in the same sort of way. So I'm familiar with this like concept from like a different sort of lens. But yeah, I think I get the drift. So how do okay? So
Yeah.
somebody's bouldering and they take a fall and some pee comes out. How does that? How do they get to that place? Is that? I'm gonna guess that's not like there's anything wrong. And I know that like pregnant and like women who have gone through menopause, and I think I even know like with men who power lift really really heavy, it's also not super uncommon, things like that. But is a pelvic floor issue like something that went wrong at some point, or is it just history and it's a normal thing that people will experience? Yeah, like how did they get to that place where pee is coming out when they fall?
I was bouldering 2 weeks ago and I made a move. It was outside and it was kind of like a traversy climb. I was going out to the side, didn't stick it, and just fell straight down like on my butt. And I
Hmm.
leaked a little and I was like,
Hmm.
dang it, this sucks. Like, how did I get here?
Hmm.
And there's so many different reasons why. Now I can just speak to myself, like, why do I believe I got there? I've been doing like a lot of self exploration of like my pelvic floor habits. And something that I do often, and like I have a very extensive history of lifting weights. So I believe like my pelvic floor, it's pretty strong. But if I like assess videos of myself or or just like even I've been paying more attention of like what am I doing with my core when I'm lifting heavy, and I just like I go into the basement.
Hmm.
So I'm like pushing down, and
Yeah.
and it's like really for me it's so strong. Like it's a
Creating
good
like
like
intra-abdominal pressure, right? Or
yeah,
like,
yeah.
yeah. Okay. Continue. Sorry.
Yeah, no. Yeah. So I think like that's my pelvic floor muscles, like that's like a really strong position for them. And
Okay.
so, and then at the same time, again, you can share this, but at the same time, like when I go to the bathroom, I am so blessed in that I have fabulous bowel movements and I can go, like I wake up in the morning, I go, like I'm going throughout the day, it's great. And I'm fast. And so I noticed that I'm fast and I go often because I'm just like, and I'm like pushing down, I'm pushing it out. So I've stopped doing that. It's actually, I'm to the point now where it's like I have a lot more peace with it. But I was so frustrated because I was like, this is so inefficient.
Yeah.
I'm like sitting here and I'm breathing through it. And now I'm like not doing my morning poops anymore. Like, because I don't actually have to go as often as I thought I had to go.
Yeah.
So how did I get there to where I made a move? I landed on my butt and peed a little. I think it was like such this big impact and it was just like too much. And I'm always down here. And it's not that I want to go up to the attic, but it's like I want to find somewhere in the middle and not always being pushing down.
Yeah.
So, and
Interesting.
this is really, this is a normal thing too with like people have a pattern, it works for them and they're really strong with it until it's like, what's that phrase?
Tipping point?
The iceberg.
To the tip of the iceberg? The tipping point? I don't know. I don't know what we're trying to say, so I'm not sure which idiom to deliver.
It's like there's something that tips the iceberg and then they leak. I don't know. That was
Sure. Yeah. I'm following.
anyway.
Yeah. And I
That could be
understand.
what.
I understand where you're coming from with the bowel movements thing because again, I've had issues with that stuff for a long time, and I think our lives are so fucking stressful, and I think there probably is just an epidemic of people who treat pooping like it's another like task that they have to accomplish as fast as possible, and
Totally.
it does not make me excited for potty training, knowing that I'm like setting my kid up for how they're gonna deal with this for the rest of their life. But it really is hard to like. It's something that you can't you can't try hard your way through it, and I think that there's a lot of people who maybe don't understand that, and I myself did not understand that for a long time, so
Totally.
good for you for getting it sorted out.
Thanks. But another scenario could be like, all right, let's take like the same climbing move, a different person, and they leak. And let's say that person just got off of like having a cold, or they're like really stressed out. No, let's say cold. Let's stick with the cold. Let's say they made the same move and they just got over a cold and they were coughing so much. Like when you cough, though you're not like landing on the ground, you're still increasing that pressure. And your pelvic floor is responding to that, right? So their pelvic floor might just be like super fatigued. That doesn't mean something's wrong with them. It's just like tired, just like any other muscle in your body would be tired.
Totally. It makes 100% makes sense. And it's interesting, the A-frame house thing is kind of clicking with me because I think I am quite good at bracing with squat and deadlift. Like I kind of got into weight training. I mean, I had tried it and played with it and done starting strength and stuff like that. But when I really started weight training was when I hurt my back quite badly about 10 years ago. And I went to a gym it was for athletes. It was like rehab specialists who were like getting athletes back to sport. That's like what they worked with other people in general population too, but they were like, I just found them by sheer luck, honestly. And they were recommended to me as like a group of people that helped athletes get back to sport. And they were like, oh, you hurt your back? Like you're going to deadlift. And they taught me how to brace like really well. And they were like, you don't need to be afraid and bracing all the time, but like, this is how you do it. This is how you make the barrel. That whole thing of like how to expand using the breath and like push outwards against your rib cage. And it totally, the A-frame thing, it totally makes sense that you're pushing down into I see the house being squished down into the basement when I do that. But I was always taught it as like an expanding outward, like laterally thing. But it does make sense, and I can actually feel it. I was sitting here bracing and thinking about it. That you are pushing down into the A-frame as well. So that makes it make sense why when people squat really heavy, sometimes they pee because that's a lot of pressure.
Yeah. Yeah. And like there's also like there's different ways to do one thing, right? Like if you don't have to brace every time you deadlift.
Yeah, for sure.
When you're bracing really heavy, it's more efficient and helpful to brace,
Hmm.
but you can stay up in the attic as you do a squat. You can like go if you're doing a light squat, you can like go out down into the basement as you go down in the squat and then come up into the attic as you stand up in that squat. So there's like so many different things that you can do with it. And it's just like nice to do what you want to do when you want to do it with
Sure.
with your
Yeah, and
pelvic floor.
I think the bracing thing, like, it was really helpful for me at the time because I was just so afraid. And nowadays, like, if I go out to the garage and I usually start with a plate on either side of the bar, and like I just pick that, I just am in my Crocs. I just got in the garage and turned the heater on, and I just like pick that up a bunch of times. I don't think about what I'm doing like at all. And then
Yeah.
as it gets heavier, I start to think about it more and like brace more, and I'm bracing for my like my heavy working sets. But like, it's it was useful for me at the time, and then it was also useful for me later to be like, okay, I don't need to like brace every time I bend over. And I'm sure it's kind of the same thing, in the sense that like you want to have control over it, but you don't want to like assume that any one strategy is the only way to get through it.
Yeah. Yeah, and then one more example with that, or like just thought with when you would like fall from climbing and let's say you leak a little bit, like you don't want to stay in the basement and you don't want to stay in the attic. Like you want your pelvic floor kind of to like absorb that shock. So like that reflexive movement is your brain starts to fall. So your pelvic floor is going to like slightly go like this. And then before you even, or basement, very small. And then reflexively, the second you land, go right up into the attic. So it's like, yeah, you don't want to stay down here all the time. You don't want to stay here. Like you want to be able to just like have
Hmm.
that movement so that that reflex can actually happen.
Yeah. So it like bounces back a little bit more. Okay. I
Yeah.
think that makes sense. And I think I've already laid this out, but like this is not just a women thing. This is men and women. Are there are there other pelvic floor dysfunctions that you treat regularly as a PT or that you want to talk about?
Um,
Is leaking kind of the primary thing?
no, I guess like, well, I'm just thinking like what would climbers experience? Like prolapse is also a really, normal thing, especially after having a baby.
Hmm.
That having prolapse or the sensation of having prolapse uh, is it's like this heaviness feeling in your pelvic floor. So that could happen too, like when that pressure increases. So like you don't have to necessarily fall to feel that heaviness in your pelvic floor. So like let's say you are in an overhung route. I don't know why I say overhung. This could happen anytime, but you just do like a more powerful movement,
Hmm.
which when you do that powerful explosive movement, that's you're engaging your whole system. You could feel a little bit more heaviness or like, oh man, this kind of gets in the weeds, but like that also doing a powerful movement, having your whole system be engaged could reduce those symptoms.
Hmm. Interesting.
Because you're just feeling more like, because when you would do that powerful movement, maybe you're going up into the attic and there's just more support,
Yeah,
less
it depends
downward
on the
pressure.
nature of the move, I'm sure, like to some extent.
Potentially. Yeah. So that could also be something that people experience. And I think like have you heard of prolapse before?
I have, yeah. You can
Yeah.
describe it if you want.
Um, yeah, it's essentially like this my hands are your vaginal wall and it's like the front or the back or the top, kind of just like having more movement. And so that more movement is going to like, let's say down here is the opening. It's just going to like put a little bit more pressure, make things feel different down at that opening.
Hmm.
Um, this extra movement is so normal after you give birth. You want there to be a lot of movement there so that baby can come out. And it's not just going to go right back to normal
Right.
after giving birth. So it's very realistic for you to, this could be a good segue into like, when do you start climbing postpartum? But
Hmm.
it's very realistic for you to climb after giving birth and be like, oh my God, do I have prolapse? I'm feeling heaviness down there. Well, think about like is this 4 weeks after giving birth? Is this six, like you can still have a lot of that movement up to, 12 weeks after giving birth. So it's not a diagnosis of like, oh my God, I have this prolapse and I can't climb. It's all right, well, let's think about like where you're at and how did you brace? Did you go into the basement? So now that more movable wall is like more pressure down or did you pull up and go into the attic? So,
Yeah.
yeah.
Yeah. It really, there's like very few hard and fast rules. It seems like, and each case is kind of individual. That seems to be the theme of the whole thing.
Right. Which, if you think about like, really any injury,
Yeah.
there's no hard and fast rule.
Okay. Oh, that's perfect. I wanted to ask that question because I've heard people, even like what seemed like, pregnancy or postpartum, like, I don't know, PTs or influencers or something, call pregnancy an injury. And like, I think as a man, I just have no frame of reference for any of this stuff. But like, does that seem right to call pregnancy an injury? Like, I get it. You know what I mean?
Yeah,
I feel like there's a part of me that's like, would some women find this like offensive or something? I don't know, but it makes sense. It's like 2-year recovery process. Your body goes through a lot of changes. Your training has to change in the interim. You're never quite the same, in every way. Yeah. Is it fair?
Yeah. I've definitely said that. It's something I've taken back a little bit, not because it's not you're not injured. But I think you handle it very similarly. So maybe pregnancy is not like an injury, but you approach pregnancy how you would approach, I don't even know though, because life, it's just life. Like when you get injured, all of a sudden it's an opportunity to like be progressive, which you should be doing anyway in your loading. It's an opportunity to have a conversation about recovery, which like injured or not, you should be recovering and like having time and space for that. It's an opportunity to talk about nutrition, which like in life you should be, thinking about your nutrition, and that doesn't change when you're injured. Doesn't change when you're. I've just had that realization right now. I don't know.
Yeah, I mean, I think that's that kind of makes sense to me because injury is also. I have a hard time with things that are framed as being very binary. Like people will talk about like being in climbing shape or like, oh, I'm not in climbing shape right now, or like I am injured or I am not injured. And there's like, I have things that hurt all the time. I'm 39 and I've been like pushing really hard for a long time, most of my life now. But like, I still don't call myself injured, even if something hurts like pretty bad. Like I wouldn't call myself injured unless I like, knock on wood, like fell and broke my leg or something like that. And then I'd be like, I'm injured. But like until that happens, I'm kind of just like, I'm just like adapting. I'm just like just dealing with whatever these things are.
Totally. I think like the one that's so funny. I think the one thing like when like labor and delivery, that feels a little bit more like an injury. Like it's trauma. It's trauma to your pelvic floor. It's trauma to your abdominal wall, whether you had a C-section or not. Like, and that I think maybe I would frame more as like, that feels like an injury that we need to honor, recover. We do need to like fuel more than not so that our body like has the calories and the energy to encourage that healing. So, and that feels very in line with an injury. But yeah, I feel the same way. I'm like, oh, my finger hurts, but I'm not injured. I just like, and it kind of climbed a little bit too much.
Right. It could be. Yeah, I guess that's one thing with pregnancy is like it is highly individual, and you have to sort of take as it comes and make good decisions about your loading and stuff like that, in which sense it is a little bit different than like especially a chronic injury where like it's going to come and go depending on your loading. But pregnancy does have a pretty sure timeline, and like if it's a full pregnancy, then it ends with a baby. You don't know what the birth is like, but there's going to be a baby at the end of some kind.
But I have had people like come to me and they're like, yeah, I stopped climbing last week and they're pregnant, and I'm like, okay, like let's talk about this a little bit more. Like, why did you stop climbing? Is it something you just like don't want to continue doing? If that's the case, don't climb. But more times than not, it's I just wasn't feeling good. I was like, okay, well, why weren't you feeling good? And then usually we can get them back to climbing if that's something that they want to do in a way that makes them feel like good.
Yeah, so there was like, I almost brought this up earlier, but there was like a couple periods. So Kim didn't boulder much in the first trimester, and then we actually climbed like a good amount. Like we went to Squamish, and she bouldered there. I just like spotted her really closely because she didn't want to fall and stuff. And then we did a lot
Yeah,
of
of course.
like sport climbing in the gym. But it was causing her like a lot of pelvic pain at points. And like when that would happen, she would just like back off of it for a little while and then go back to it. And then it would other times feel fine. But, yeah, it was cool. It was cool to watch because in that sense, it really did feel like this thing was really important to her. And she was like willing to just show up and like give it her best shot and like see what she was capable of on that day. Right up until I think maybe, I don't know, 2 weeks or something before Charlotte. Okay, maybe a little more like 3 weeks because there were some things going on. That whole period is a complete blur.
Sure. Yeah.
All right.
Yeah. No, that's super cool.
Nice. Let's talk about birth because obviously that is the next step. So I kind of mentioned earlier that I knew there was some research that showed that like women who kept lifting throughout pregnancy had better birth outcomes. But is there specific training that you recommend pregnant women do to be ready for birth? Is it just like what they're comfortable with and keep them as active as possible? Or are there like, because here's the thing. We took a birth class and we wound up having some complications. And so Kim got a C-section. But like just taking the birth class and like learning about the averages and stuff as a man, like I was kind of mortified to go through that process as a man. Like so much standing and bending and like holding positions and like squeezing really hard and just the caloric expenditure is crazy. It's a marathon, right? It's like, how do you prepare yourself for that?
There's this there is this phrase that's going around that I've been enjoying where it's like, yeah, labor and delivery is like a marathon. Are you going to go into it trained or untrained? So I think like when do you start preparing for that? My type A brain is like, I'm preparing for it right now. Like I'm preparing to give birth. I'm not pregnant. But let's say, it's never too late to start. So like you could have never exercised in your life. You can start in that first trimester. You find out about exercise 3 weeks before you give birth. Like start. Do something because that is going to help you with labor and delivery, like have the endurance and just be able to handle these positions. Now, this is not evidence-based, but what I like to do with my clients is like we get into some of these positions that feel comfortable for them. So like I ask my patients like, hey, like what positions do you feel good in? Let's go in those positions and let's like practice going through the A-frame house. And all right, let's go down because it's nice to think about when you're giving birth, going down into the basement, because now all of a sudden we're like, if you think about what's happening with the pelvic floor in the basement, they're like the muscles are more like lengthened instead of like contracted and squeezing up. Like you don't want to be squeezing up against a baby that's trying to come down. But that's really hard for people to do because they'll just be like squeezing, and when they squeeze, if they haven't practiced it, you'll probably go up into the attic. Yeah, maybe not. But
they talked about that a lot in the birth class, like that you can't. It's again, it goes back to the pooping thing. It's like you can't try hard what's happening, but it's also your body is trying hard. It's not. I don't think you can not try hard.
Yeah. It's a hard thing to do. It's hard. Yeah. So. So I'll have people go into positions that feel good for them and practice just like breathing or going down into the basement and they're staying there. Oh, it's snowing. They're staying in that basement while they're breathing. And then we'll also do like different just positions that, I know will open up their hips. So they'll, go into child's pose like with their hips back or go into like a deep squat with support under their pelvis, or they're holding on to something. Maybe they're laying on their side with a leg up and supported. And we're just like, hey, do you feel comfortable in these positions? Are you curious about feeling comfortable? Can you, like, if it starts off not being super comfy, can we build tolerance there? And then, so that's like, I think that's important, but I think what's even more important than that is just like, what are you doing throughout your pregnancy?
And staying as active as you can. Trying to give yourself as good of a shot as you can.
And having like, how can you prepare for birth. It's having people like you sound like you're such a great husband and you were there for Kim but that's important. And there are studies on like, all right, what happens when a midwife comes in? What happens when a doula comes in? And it's usually a better experience.
Yeah, for sure. Yeah. And I think we were quite, there was a lot. I don't know. I'm not going to get into our whole birth story, actually. That'd be fun to talk about, but maybe not on the podcast. Maybe someday.
Yeah. I'd love to hear it.
Okay. Let's talk about returning to sport, and we'll just set aside the fact that these people have a baby now, probably, hopefully, cross fingers. But yeah, nobody talked about that part with the returning to sport after. Like, I haven't heard that. Yeah. But what is the general? Do you have a general recommendation? I feel like a lot of the way you seem to think about this is just very optimistic. Like when you feel like you're ready, or is there like a 30 days, 4 weeks, something like that kind of?
Sure.
Yeah.
There's no hard data on like this is when you are allowed to. The recommendation is usually 6 weeks you can return to X, Y, and Z. And again, it goes back to what we talked about earlier. If you ask your doctor, like, hey, why 6 weeks? Like, why that recommendation? There's usually not a response like, that's just like kind of what we do. It's not based on anything. So it is, yes, it's just very individualized. I like to encourage people to start moving as soon as they feel comfortable. And I think like setting up before they give birth what the expectations are of like what can movement look like for you. It's not go to the gym and hop on the wall a week after you give birth. It could be just like getting out of bed, walking around. Maybe you're doing some like gentle movement, engaging your core. You can start engaging your core right after you give birth. Like if you want to, you can do that. And then same thing, this doesn't really change like the timeline a little bit with C-section, but I still had clients who like, they're climbing 3 weeks after they've had a C-section. I've had patients who, 3 months after C-section. So again, just individualized, but it's what you feel comfortable doing. And understanding like you might feel some heaviness in your pelvic floor. There was that extra movement, and that's like, okay. I think some red lights would be, are you having increased bleeding? And that's just a sign for you like, hey, maybe you pushed it a little bit too hard. So we have to not stop, but dial back that intensity. Or if there is like pain and it feels uncomfortable, this might not be the best time to push through that pain. Like we don't have to do that. What else? Listen to them just listening to their body. I mean, the other red lights would be like, so like you'd be in the hospital still, like extreme shortness of breath. You're having a blood clot. You're having like, very noticeable like heart rhythms that are so uncomfortable that you're under like medical care. And we can put this in the show notes too. Like there's this questionnaire that's like, if you say yes to anything, ask your doctor if you can, before you start physical activity. And it's like a broken bone.
Yeah.
It's like
severe,
really severe things. Yeah. And then also too, like with a C-section and if there's tearing, usually there's tearing. So we'll just say C-section and tearing, understanding like what are signs of an infection and being able to, I probably wouldn't be exercising if you have an infection.
Right. I mean, yeah, those things are almost more like medical in nature and less like return to sport type. Yeah. So that makes sense. Yeah.
I think what I've seen climbers run into is they've done all the things. They like worked out throughout their pregnancy. They had like actually a really great labor and delivery. And then they go back to climbing and they're like, well, I did all the things and they get caught in this, like, this isn't how it feels, or this isn't how it felt before I got pregnant, but I did all the things, like, what's going on? And so I think too, just like understanding you did just go through a pregnancy that really does change your body.
Yeah. You
went through labor and delivery, which is like such an intense event. And now your body is recovering and your body's feeling different. And this is sometimes a hard conversation to have, but the reality is after pregnancy, your body has changed.
Yeah.
And it will feel different. And you might not feel how you felt before pregnant. That doesn't mean you are not going to feel stronger. That doesn't mean you're not going to climb harder. And we see it all the time that like that does actually happen, but it feels different. And so
Yeah.
it's hard.
That's something I saw in that Hazel Finley survey was like it, and I'm just kind of reading the tea leaves. I don't think there was an explicit question, but it sounded like, especially for the parent who carried the baby, it wasn't necessarily that they couldn't climb harder, but to a certain extent they like lost interest in it. It like wasn't as much of a priority to them. And I would need to like look really closely at the questions that were asked and stuff, but it did kind of make me wonder, you know, when we talk about return to sport, and I've even had this with return to sport from an injury, so I could totally believe it with from pregnancy, but there's always like other things that change in the interim about your relationship with the sport. And that's so complicated with having a kid, because Kim is still keeping this kid alive, you know, via nutrition. And so like that in and of itself is your sleep is not going to be normal. You have a tremendous like demand on your time and your attention of this baby. And so like, it's actually crazy to me seeing, I mean, the comparison trap is so brutal on social media for everybody, but like seeing these athletes like Shauna Coxey climbing V14, I think, I don't know, not that long, a few months after having a baby. And then, you know, Jenya Kazbakova just climbed Necessary Evil, I think, a few months after having a baby.
Yeah.
Which is a route that like a lot of professional climber, like men and women, like cannot do, period. So it's like, it's obvious that there are like outliers.
That mom strength.
It seriously is. It's like crazy impressive. It's obvious that there are outliers, but I'm sensitive to like how difficult that comparison trap must be for moms who like don't have it that easy. I mean, like even if their drive to perform is still there, the demands on your time and attention, even if you were lucky enough to have like maternity leave, let's not even get into that whole conversation. Yeah, it's very demanding having a baby around suddenly.
Yeah. And not to say that their experiences were easy.
Totally.
And, you know,
that's true.
yeah, and they've spoken to that as well a little bit. Like, I think it feels like such a cop out, but it's just so true. And I kind of love that this is the case, but it just, again, is so individual.
Mm-hmm.
Hard to say, like, that's hard to accept because it is so easy to compare. But if you were to talk to them, they'd be like, hey, we had our struggles too. It just looks different.
Yeah, I'm not trying to say that what they did was easy, by the way.
Yeah.
I hope it didn't sound like I was saying
sure.
that.
No.
What I'm saying is more like it must be, I don't know, like when I see pick your really strong, like pseudo professional climber who's like 40 or in their 40s, the demographic that I compare myself to, you know, and I see like Martin Keller, who I think is mid 40s or like late 40s, like climbing frickin' V15 or V16 and like going out and having 4-hour night sessions and then driving home and like sleeping for 2 hours and going to work. And I'm just like, yeah, I can't do that. You know what I mean? Like the comparison trap is very, very salient. And so I can only imagine going through something as extreme as pregnancy. It's got to be like pretty difficult.
Yeah. And I mean, if you look on social media too and you like type in postpartum, all it is like comparison photos and like before and after photo. And it's like social media is just all not realistic. So
Yeah.
it's so hard. Or it's like, you know, all these different like postpartum programs get you back to pre-pregnancy or get you looking blah, blah, blah. And it's like so focused on like performance and looks and
rushing it.
Yeah,
It feels like it's rushing it. Like, I don't know. I'm 4 months into being a dad and I'm kind of just like, yeah, like give me like 2 years before I have any idea what I'm doing. And at that point I'll have a 2-year-old, which probably doesn't make it any easier.
Yeah. I like to focus on just like celebrating the small wins. Like oh wow, you like had a climbing session where you were able to like focus on your climbing because your partner stayed home with the baby, or the baby went to the gym with you and slept through it, or just, you actually had 30 minutes to yourself and you were able to climb and you were stoked on something and you sent it. Like, let's celebrate that.
Yeah.
And I think
Hell yeah.
that those like little chunks of like celebration go a lot further than like, oh my God, I'm, 6 months postpartum and I'm not feeling anywhere near to where I was before, or
Yeah.
not where X, Y, and Z was. Yeah.
This is like, this is just, let's talk about me. This is just me talking about me. But for the first couple months of Charlotte's life, I did all the dad stuff and I like took really close care of her and everything, but I didn't feel like I was like bonding with her super well, which I think is fairly normal for guys. And then once she started like smiling and making eye contact and the oxytocin was hitting, is like that came online very, very quickly for me. But it's been cool because I've had some really good climbing experiences since she was born, because my wife is incredible and lets me go climbing and like try to do the thing that I really care about doing. So thank you.
Yeah.
Very thankful for that. But it's been cool to me that like those experiences have been great, but I've also had lots of really positive experiences where we're just in the gym bouldering, handing the baby back and forth when the other person climbs. And like, it just I feel very deeply identified with that experience of like handing the baby to my wife and like trying to climb something in front of all the 18-year-old kids who are there, And I'm just like, hell yeah. Like,
You're a role model.
Yeah. I'm like, these guys probably think I'm a nerd. Like, 6 months ago, they're like, who's this old nerd at the gym? And now that I'm like here with a baby, I'm like, yeah, I'm like a dad. Like now I have like an aspect of my identity that like makes it more okay for me to be here, or so, I don't know why I feel that way, but I identify just as strongly with those experiences as I do with going out and like climbing something that I'm proud of, even though that's obviously really important to me too. And I don't know, I'm hopeful that as Charlotte gets older, it becomes more of what Kim does too, because she's going to the gym and stuff, but like I want the whole family to, yeah. We're going to Chattanooga in a few days, so I'm excited.
I know. That's so cool.
Yeah. Should be fun.
And is it
First
like,
trip with the
it's a
baby.
family climbing trip?
Yeah. Family climbing trip. She's probably going to be on her 4-month sleep regression, so I might sound really tired in my next couple podcasts.
Oh man.
We'll see.
Ugh.
I'm sorry for that crazy dog leg.
No, I think that's a great example of like, it looks different, but like you can find this feels good,
Nice.
Instead of being like, oh, I gotta like, just be, no shame if anyone thinks this, like, I gotta hand off my kid, like shifting that perspective and just being like, yes, this feels really good and I get to do this. And yeah.
Yeah, for sure. It can definitely be a positive thing. I mean, I feel like we were well prepared, and a lot of people probably are not always like super, that's the advantage of being older parents, is like we have a little bit more space in our life and a little bit more knowledge that we wanted it and stuff. And not everybody comes into it that way. Some people definitely do. Yeah. It's different for everybody. Yeah. Let's just leave it at that.
Yeah. And I think, were y'all, I can't remember if you said this before, but were y'all like the first people in your friend group to have kids, or?
No, definitely not.
Okay.
Kind of like a lot of people that we know have had kids in the last few years, because I think it was sort of like the last chance to kind of, like, I'm 39, she's a little younger than me. So yeah, not the first. Charlotte will be the younger sister to a lot of other kids, I think, but
a lot of cool kids. Yeah.
We also got a lot of stuff for free, which was very, very, very nice.
Yo, all the accessories are insane.
Yeah, it's crazy. And then we're way in the weeds, but my dad and his wife come visit, and he's just like, oh my God, you have so much stuff. Like, because when I was a kid, they were like, they took construction paper and like, cut it into and stapled it into a circle, and they were like, here's your toy, and I was fine with that. Like, so it goes.
That's awesome.
All right. I brought up social media because I wanted to talk to you about, and you kind of touched on this, but I felt in our pre-interview like you had a little bit of a soapbox you wanted to get on about like some of the misinformation. So are there things that you commonly see on social media that you want to call out as potentially being like scientifically problematic, let's say, or just wrong? Just wrong.
Yeah. Yeah. I mean, we have touched on this already, but exercise, there are no exercises that exist that will cause a miscarriage. And I have seen that on social media where it's like, if you do, and I saw this one post where it was like all hip opening exercises. And I was like, is the baby good? Like, what's gonna happen here? What's the thought behind this? But anyway, there's no exercise. And that's like kind of great news because of all the benefits of exercise. And it's like, there's nothing that you do that's leading to that. And I think that we get caught in this thing of like, oh, what could I have done differently? These things just happen. That's one thing.
Okay.
Another thing is exercise on your back. There's a lot of people who will say like don't exercise on your back, especially once you get into like that more end of second trimester, third trimester. And the reason for that is because there's like pressure on one of the like our veins that bring blood up to the baby or whatever. And the compression is negligible for the amount of like blood that is or is not going to baby. And you'd have to be laying on your back if you are to start having symptoms, because sometimes like this will happen in some people, but not others. You'd have to be laying on your back for such a long time. And the symptoms that you would want to look out for is like difficulty breathing or like pain in this area. But there's no exercise that I can think of that requires you to lay on your back for that long. Some people will lay on their back and they're like, I can't really, breathe when I'm laying on my back. That's super fair because, it's like harder to breathe. There's extra weight. And so then I would say like, just get off your back if it's not comfortable for you, or elevate your back like on a bench or something. But from like a standpoint of, will your baby be okay? Yeah, your baby's going to be okay if you're laying on your back.
Good to know. It's harder to breathe in general when you're pregnant, from what I understand.
Yeah.
There's less space. Lungs can't.
Yeah. Like everything starts to like move up. So it's hard.
Again, this is just like Jesse's story time to like punch up all the information. But it seemed like one of the worst parts of climbing while pregnant for Kim was just that when she was sport climbing, first of all, the harnesses are just horrendous.
I know.
I don't know. Is there a good brand of pregnancy harness? Do you know? No,
there's not.
No such thing.
And the harness, like for people who are like, what are you talking about? It's a harness that like you put around your arms, your legs, and like where you would put the rope is like right above the belly. But I just read there's an article out there that's like risk assessment from elite climbers while they're pregnant. Whatever the title is, that's not the exact title, and someone was talking about how they actually opted out of that harness and they just kept wearing the regular harness and that felt more comfortable for them. I'm not recommending that, but I was like, I didn't even think of that kind of as an option. But they felt like they could sit more upright when being lowered.
Gotcha. Okay. Yeah. I thought there was like a, top heavy, like worried about falling backwards, maybe element to it. I don't know.
That was the first time I ever had read it. Yeah, I was like,
okay,
oh, that's interesting.
Yeah.
But in regards to like, is there a harness that, no, there's no brand that's comfy. It just kind of is. This could be, the space to enter into if you're looking for a product.
Oh, sure. Well, it's kind of, so maybe this is related to why they suck, but like when she would climb, it would be fine. But when she would be lowered, just the way that because it's clipped across the sides, basically right above the belly, there's like 2 loops instead of 1, and then you put a carabiner through both loops, and like it just compresses the whole like chest, the whole like torso, and so like by the time she would get to the ground, like she'd be out of breath by being like squeezed by the harness, and she'd have to like lay on the ground for a minute, and it's just really sad. Yeah, but she got to climb. So other social media like myths, red flags.
Okay, so diastasis recti. Your abdominal wall, it's like two sides coming together right in the center, like where the belly button is, and then along like that entire line, like up and down from your belly button. Their fascia is like a fascial connection, like connective tissue. And that has to stretch and lengthen when you become pregnant. And so if we think about this like idea that we've been talking about with like pressure increases, and we talked about your pelvic floor handling that pressure increase, but your core also does it. And so with that stretching of that like space in the center of your abdomen, that is going to be a vulnerable point where like pressure can release. Does that make sense?
Yeah, yeah.
Yeah. So because of that, there might be a point in your pregnancy where you are climbing and you look down at your belly and you're starting to see like that pressure push out against that area. And it kind of looks like just a little round area.
Mm-hmm.
That can really freak people out. It's called diastasis recti. And so that gets a lot of hate of like, oh my God, my abs are ripping apart. My core is going to be ruined. I'm going to ruin my back, ruin my pelvic floor. Like when the reality is like, we don't have evidence to support that. And I've seen this clinically as well to like support that evidence where people will be coning and they still have a really strong core and they don't have signs and symptoms of pelvic floor dysfunction. They don't have pain in their back. Like everything's working fine. It's just like a lot of pressure and it's stretching. And again, we want that area to stretch to make space for your baby.
Right.
And so then let's transition to postpartum. That can still show up where like it takes time for that stretch to kind of get that tension again.
Okay. So
and we can encourage
pregnancy.
Yeah.
I'm going to sound like a colossal moron here, but is diastasis recti the same thing as coning or doming? Are those all the same thing?
Oh yeah. Sorry. Yes.
Okay.
Yes.
Okay.
It's
just making sure.
Yeah.
Because I had always heard of coning and doming in pregnancy, and then I had heard of diastasis recti like postpartum, but I just didn't know that they were the same thing.
Yeah. Yeah. It's the same thing.
Okay.
Yeah. Same thing. But there's a lot on social media that will be like, if you see diastasis recti or coning doming, whatever, stop doing that exercise. And I don't know, it just like buys into this fear of movement and like, oh, I'm not strong enough. I'm weak. I have to wait. More barriers to movement. And, I think it's just like feedback of, oh, this is really hard. And you just carried a baby and things got lengthened and it's probably still fine. There is no even association between diastasis and pelvic floor dysfunction. But there often is where people will be like, oh my God, like, you know, this is happening. And now what are all the other bad things that are going to be happening? And in where I've been educated, and I love the organization that I got all my training from, they'll say like, all right, let's say someone's climbing and you see them have the diastasis. You can do two things. One, you can cue them how to engage their core and see what happens. And two things can happen. One is that diastasis is going to go away or it might not.
Okay.
So it's like,
what's the other thing you can do? So you can cue them to engage their core. It'll go away or it won't.
Yeah. Okay. Sorry. Thank you. Yes. Yeah, you can cue them to engage their core, or you can cue them to like not engage their core, but maybe like in that move, it was like a little sloppy or not controlled. You can like maybe cue them to have more tension throughout that move by, you know, pushing into the wall with their feet, utilizing their hips a little bit more. And like, did the quality of that movement get better? And if the answer is yes, and you still saw the diastasis, that's okay.
Okay. Yeah. So you can either tell them like, it can be an explicit, like squeeze this area, like contract this area, like try to squeeze your core, or it can be a more general, like focus on the way they're doing the move and like try to see if that helps them create more tension sort of incidentally kind of. Okay. Gotcha.
Yeah.
I see.
And you could, and the reason why you would tell them to like maybe engage their core is because we do know that like the more you engage your core during physical activity, the more you'll help stiffen up that area, right? Like same thing with exercise. Like when we get stronger, we get a little stiffer. Stiffness isn't a bad thing. It's just a side effect of getting stronger. So, That's why you would want to do that. But it's not bad. It's not a bad thing if that diastasis is happening. It's not going to lead to a lot of different complications that are often advertised.
Yeah, so it's I just want to repeat back to you what you said, because maybe I'm playing devil's advocate here, but
Yeah.
if it's not bad, if it's not dangerous for that to happen, like, why are people so obsessed with like demonizing it?
Yeah. A lot of it comes from cosmetic standpoint. So it's
It
like,
just looks
oh,
scary.
this doesn't look good. But
Yeah.
not even scary, but like now all of a sudden you're looking at your belly and you're like, this, I don't want my belly to look like that, which is so fair. Um, so
Okay.
yeah, does that
There's
answer your
just no
question?
there's no science to say that it's like dangerous. It's just a broad kind of urban legend. Wow. Okay. All right.
And it cues you into your core could be engaged a little bit more efficiently. So, if your core is engaged more efficiently, force transfer is going to be improved. So, like from a performance standpoint, it's going to help you perform, but it's not going to lead to back pain. It's not going to lead to your core's ruined, and it's not going to lead to now you're peeing all the time.
Yeah. Gotcha.
Which those are the claims that are often made.
Gotcha.
So
And we just don't have science to verify that.
yeah, and I would encourage someone to like get their core engaged so that it's just better force transfer, and that's why I say like you could do those one of two things where okay, let's say that coning doesn't go away, but then you improve the quality of their movement. That's the purpose of it anyway, is to like force transfer is going to improve the quality of their movement.
Yeah.
So yeah.
Makes sense. That's cool. I mean, I love anything where it's like you don't have to do this or you don't have to like worry about this. I think that's great. It's very freeing.
Yeah.
And if
Yeah.
people are worried about it, or if they're just worried about it for like aesthetic reasons, they just don't like the way it looks, or they're just freaked out that it is going to give them one of those problems. Like that's also okay in the sense that like, it's their body and their life and all that stuff, so yeah.
Yeah, I think all of this just goes back again to autonomy. Like, hey, here's the information from a cosmetic standpoint. If you want to improve this, let's freaking do it.
Well, okay. I feel like we've gotten through a lot of the list anyway. So, any things that you want to make sure we talk about? What have we not covered? Oh, you wanted to talk about picking a provider, like red flags for picking a provider. How would you pick a provider? How about that question?
Yeah. Um, I would pick a provider that's like, it's very clear that they're promoting movement. So they're promoting, like, they're not increasing the barriers to exercise. Because there's a lot of fear mongering out there, which, this is also kind of hard because, like, I've gotten business advice from people to play into that fear mongering
Yeah,
because that's what works.
same.
And yeah, so I don't actually, that's actually a hard question to answer, but I do think that their training matters. So like, are they like a self-proclaimed postpartum pregnant pelvic floor provider, or do they have like appropriate training, and have they taken like you know courses by institutions, I don't know, that like are good.
Yeah, 100%.
Because I think that's, yeah.
When you first said you think their training matters, it's just what I think about all the time. But I was just like, oh yeah, you totally want like a doctor who like lifts weights and like training. I was thinking
Well,
like training,
oh,
but yeah,
training.
that makes academic training makes way more sense. But I actually do feel that way at
Both.
this point in my life. Like if I go see a new doctor or a new specialist or something, and they're like obviously very scrawny and like not in good shape, there's like a small part of me that's just like, you're not going to understand so much of my worldview, and it's
Yeah.
so fundamental to my understanding of like health and what makes it worth being alive. It's hard for
Yeah.
me to like
I
connect.
yeah, I like agree and also caution. Like it's hard for me to fully agree with that because I've never been pregnant. I've never had a pulley injury. Like I haven't been injured before.
Wow,
So
at all?
or
Okay,
like or
sweet.
or like, I hurt my hamstring before, but it was like I was still doing things. I don't know.
Yeah,
So I haven't really So it's hard for me to be like, oh, well, I've never had this experience. So, and I think that I actually was listening to a podcast recently where they talked about like, there's some traps that you can fall into where it's like, I care about fitness a lot. I became pregnant and now I'm like super passionate about like pregnancy and fitness. I love that.
Mm-hmm.
That
Mm-hmm.
is so cool that then they can like share their experience and share what they learned in their knowledge, but it's also N equals one.
Yeah.
And
And it's not
so
the same thing as having academic experience.
it's all important. It's all important. I think it's
Yeah.
like that N equals one because it's like not it's all we spent 2 hours talking about how individual this is. So to then take your experience and then be like, all right, I did this, so like I'm going to share this information. It might not be relevant for other people. I think there's like fantastic coaches out there who don't have like high academic, like they're not
Mm-hmm.
doctors, they don't have their PhD, and they're fabulous
That's
because
me.
they but you have
To the first
like
part,
you
I'm not
have
calling myself fabulous.
no, but but that's, I'm not saying that's bad because you educate yourself, you've taken classes, like you're not just like, I'm a good climber and this is what I've done.
Mm-hmm.
That's where it can be, that's what I would look out for is like, all right, cool, like you work out and you've been pregnant and you're really successful with that. Do you have some type of education to help navigate when their pregnancy doesn't look like yours?
Yeah,
Or
for
when
sure.
they do have like some of these complications do come up and they get, gestational diabetes or hypertension or, like things happen. Can you help them navigate that if that's not what your pregnancy looked like? And that's
Totally.
where training is important. So
I think
that's what
that's
I look out for.
I think that's a great take, honestly. And I think I that would make me want to like amend what I said a little bit about like if I go to a doctor and they seem like they don't lift weights. Because to be fair, it's like
What if they're
you're
on
right.
steroids?
It is a life experience thing. I think there's a certain part of me that's like, I just it's such a core part of my worldview now that like well-being is predicated on how well you can interact with your environment, and to a certain extent that may lack like athletic empathy. And obviously there's people who don't have the privilege of being able to interact with their environment in all the ways that they want to, and I'm sensitive to that. But also like I've just had so many experiences where a medical professional of some kind is like not able to meet me where I'm at in terms of like the things that are important to me, even though the things that are important to me are largely wants. I'm not a professional athlete. It's not like necessary to my career that I am able to climb and lift weights and stuff. It's at the end of the day mostly stuff that well, maybe it's necessary to my career, but it's not necessary that I perform at a high level, let's say. And so like it's hard to get over that barrier for me if I can't like relate to them on that level. And it is something that, like maybe a PT is a better example. I would have a really hard time with a PT that I felt like wasn't an athlete or like didn't relate to that physicality in their life. Maybe like if I had to go see a specialist, an oncologist or something, God forbid. But yeah, I would be like, okay, it's fine if this guy doesn't lift weights as long as he knows a lot about cancer.
Yeah. No, that makes, and I think life experience, it is so important. Like, I believe I'm a fantastic provider. And when I become pregnant, it's going to just like, I
Yeah.
think, open up ways of thinking and doors that I have not been able to tap into.
Yeah.
And I think at the same time, it's going to be a challenge to be like, all right, let me not take my experience and place that on other people, which it's hard to do that now.
I sort of
So,
subtly believe that all the dads that I've coached over the years, especially the ones I've coached who had small babies, are like looking at me going through having a small baby, and they're probably like, "This is yeah. How do you feel now
sure,
programming that heavy training
totally.
load for me when I had a 4 month?"
Totally, totally. And I think, then all of a sudden it's like I have a responsibility to dive into like, all right, let me read up on mom's experiences. Let me ask questions. Like, and I mean, it's so funny to see how I've transitioned as a provider over the years, where it's
Hmm.
like most of my sessions we're talking.
Yeah.
Like, I'm asking questions and I'm learning, like, what are your goals? What do you want? Where are you coming from? What's your situation? What do you have time for? And like, that's going to be what guides, like, you're guiding yourself. I'm just there to like help you with that guidance, you know.
Yeah. Awesome.
It's not one box fits everyone. So yeah.
That's very relatable for me as a coach, and I think it probably is a sign that you are a good provider. So, how can people work with you, Juliana?
Yeah. So they can work with me with Tyler Nelson. I offer training programs through there for just like general climbing, or if you are pregnant, postpartum. And then I also do physical therapy both in person in Golden, Colorado, and then also virtually. And that's under Flow State. That's what my business is called. So yeah, they can find me on Instagram, website flowstateclimbing.com.
Cool. Flowstateclimbing.com.
Yeah.
Love it.
Yeah.
Great name, dude. Love that name. All
Yeah,
right.
thanks. My logo is pretty cool too, so look it up.
Thanks for coming on the show and sharing your knowledge with us. You're an expert. It was wonderful.
Thank you, Jesse.